Very good afternoon. And this is about an evaluation we did about an edutainment program on sexual and reproductive health promotion delivered to adolescent school children called Rhythm to Life. So you might wonder what is about this edutainment. So it's kind of a education plus entertainment. So I'm Amila Chandrasiri, and I'm presenting this on behalf of my team. And so promoting sexual and reproductive health among adolescents through innovative and effective interventions has emerged as a priority need, because as a country, we have been facing serious issues related to reproductive and sexual and reproductive health in this age group. Though several awareness programs has been implemented in Sri Lanka by many organizations and many partners, the expected outcome has not been achieved due to poor reception by students and the lack of integration with the existing public health networks, because programs are doing haphazardly ad hoc programs and there is no integration. So we thought of these issues in designing our program. And this Rhythm to Life was developed by a team led by a public health specialist as an edutainment program to deliver key SRH messages to adolescents through an innovative approach. So we strategically didn't use any word like sexual, reproductive health, anything. So we put the title as Rhythm to Life. And the program was designed as a music-based edutainment program which delivered through storytelling model. So that means it was not a lesson. I mean, it was not a formal lecture. So it was a kind of a story, engaging with the audience. And the main target audience was grade 9 to 10 children. Why we choose this group? Because according to the data and evidence, for teenage pregnancies and risky sexual behaviors, this is the most vulnerable age group at the moment in the country. So this program consists of 4 to 5 segments, where each segment focuses on particular objective or topic. Relationship, we start with relationship skills, and then strengthening parent-child bond. And we also talk about saying no to drugs and violence and other two serious issues faced by adolescents. And then the most important topic, understanding physical and psychological changes related to puberty and age-appropriate sexual and reproductive education. And the content was developed based on age and culturally appropriated SRH content in the 10 life skills introduced by National Adolescent Health Program. And by the Ministry of Health, a special package has been introduced called 10 life skills. So it is about strengthening life skills to say no to risky behaviors and promote positive behaviors. So we strongly believe as public health specialists that for SRH issues, strengthening life skills should be the first answer. That should be the, that is where we should focus on. And 1 to 2 popular youth loving songs are played in each segment to supplement the flow of discussion. After each program, a system is established and promoted in the school to confidentially forward SRH issues and problems to the counseling teacher. In Sri Lankan schools, there's a designated counseling teacher in more than 90% of schools. And so this was not a one-off program. We go and we do the program and come back. In every program, after every program, we get the principal and we get the counseling teacher and we have a discussion. So we during the program, there's a one segment we promote help-seeking behavior. And in the meantime, we encourage the counseling teacher to keep a box in front of her office, because if a child is hesitate to come and speak, can write a note and put that to the box. And we also encourage, if teacher likes, to introduce a WhatsApp number where children can send their problems. And then a response system was also initiated while connecting to the counseling teacher to external support networks. And we have a well dispersed system called adolescent health clinics across the country, run by every MOH. So the first line of help is counseling teacher, and we advocated counseling teacher. If you can't handle the problem, refer the child to the adolescent health clinic happening every Saturday in the nearest MOH office. So usually we also invite the area MOH and the area public health inspector. Public health inspector is the key public health worker who delivers school health activities in Sri Lanka. So we invited both of them for our programs. And so far we have conducted more than 50 programs across southern and western provinces of the Sri Lanka, covering nearly 25,000 students. But for this evaluation, we particularly took few programs, and 2 evaluation criteria were used. And you know that there are 6 evaluation criteria in the OECD framework, but we only choose relevance and acceptance. An evaluation questionnaire was designed and distributed to participants after each session. The quantitative section consisted of 5 items which assess the acceptance and relevance, while responses given to qualitative sections were used to further elaborate these 2 criteria. An open-ended question were asked at the end, asked them to write few lines about how they perceive the program. And 3 programs conducted during the first phase were taken for the evaluation. 1 urban boys school, 1 urban girls school, and semi-urban mixed school. And descriptive analysis was done for the responses given for the quantitative section, while qualitative information was subjected to thematic analysis. So this is a few glimpses of our program. See the joy and happiness and how they been cheered up. And active engagement, we always engage students. And this is what in the program, we at one segment, we ask them to identify your career dream and go home and write it and place that where you spend most of your time at home.